This is spinal cord. Spinal cord. Posterior root with ganglion, anterior root, and trunk of the spinal nerve. And we said two ways. One way with sacral nerves, another way with lumbar nerves. How sensory fibers from inner organs goes to spinal ganglion. And here I will draw spinal ganglion. This is first sensory neuron in spinal ganglion. And what next? Oh, for example, feeling of pain. If we have pain in urinary bladder, these impulses passes with sacral or lumbar nerves, goes to spinal ganglion. And what is next? How feeling of pain? Then we need to come to brain cortex. Here it is brain cortex. And we passes from spinal cord to brain cortex. Who remember which tract in spinal cord?
Tactiles.
In spinal cord conduct feeling of temperature and pain.
Tactile authority.
It touch है substance relative touch.
Second
Nucleus proprius.
Yes, of course.
Second.
That is why second neuron will nucleus proprius, second neuron, and axon of this second neuron makes tractus, spina, thalamicus, lateralis. Here is the same. Then it continues into lemniscus.
Medialis.
It is possible lemniscus, and in your textbook it will lemniscus medialis. But if you will answer lemniscus spinalis, it is also correct. Lemniscus medialis or lemniscus spinalis, and finished in lateral nuclei of thalamus, third neuron, and then goes to brain cortex in gyrus postcentralis. But we speak about interoceptive analyzer, that is innervation of inner organs. Analyzer. And there is no specific tract from inner organs. We can use all ascending tracts which you already know. It's also possible that second neuron is substantia gelatinosa. And in this case, we will speak about tractus, spina, thalamicus,
Anterior.
then also lemniscus spinalis, lateral nuclei, and brain cortex. Or it's possible to speak about
Cuneus and
Fasciculus
gracilis,
and
cuneatus.
fasciculus cuneatus.
It is. And from
Second.
nucleus, we speak about tractus bulba
Thalamicus.
and here it is lemniscus medialis,
Medialis.
and then lemniscus medialis, lateral nuclei, and brain cortex, it is gyrus precentralis. It is also possible, clear? It is not necessary to answer all of these ways, only one of them. If it is clear for you, you can use nucleus proprius and spina thalamicus lateralis, or substantia gelatinosa and spina thalamicus anterior, or fasciculus gracilis and cuneatus, nucleus gracilis and lemniscus medialis. Clear? As you want, only one way for sensory innervation. Next, that is in true pelvis. What about inner organs in abdominal cavity? From kidney, here it is receptor in kidney, plexus renalis goes to plexus what? Celiacus. And from celiac plexus, we can pass it with nervus splanchnicus what?
Major.
Or nervus
Minor.
splanchnicus minor.
or
Or
nervus
lumbalis.
splanchnici.
Imus
the same
sometimes.
if we have imus.
Yeah.
And nervus splanchnici lumbalis also. Then spinal nerve, posterior root, and spinal ganglion. And from spinal ganglion, we already know what is next.
Yes.
That is one way. Have you got diagram of vagus nerve?
Yes.
Another possibility for innervation from kidney, plexus renalis, plexus celiacus, here it is green color that is sensory fibers. Rami celiaci, plexus gastricus posterior, then trunci vagalis, plexus esophagealis, nervus vagus,
Vagus.
and where is first sensory neuron in this case?
Ganglion inferior.
Ganglion of vagus nerve. Well, superior is the same, but it is only on the head.
Yeah.
Inferior ganglion and second sensory neuron, it is nucleus.
Sensory.
Solitarius.
That is why. Look here. This way, from receptors in inner organs, we pass through vagus nerve, and in this case, first sensory neuron in inferior ganglion, and second neuron in nucleus solitarius. And from nucleus solitarius, the same with lemniscus medialis goes to thalamus and brain cortex. That is this way through vagus nerve. And with the help of this nerve, we can answer innervation of all organs, from liver, plexus hepaticus, celiac plexus, rami celiaci, posterior gastric, trunci vagalis, plexus esophagealis, nervus vagus, ganglion inferior. And the same in all organs in abdominal cavity, in thoracic cage, ramus cardiacus cervicalis superior, inferior,
and
rami
thoracic.
cardiaci thoracici, nervus vagus, ganglion inferior, nucleus solitarius. In larynx, nervus laryngeus superior, laryngeus inferior and recurrens, nervus vagus, ganglion inferior, nucleus solitarius. Clear? Only pharynx, where is glossopharyngeal nerve? Look here, pharynx the same, receive innervation from ramipharyngeal, glossopharyngeal nerve, and first neuron, inferior ganglion, and second,
Solitarius.
nucleus solitarius. That is why in this diagram we can add from pharynx and from ramus sinus carotid, from carotid sinus, and from posterior side of the tongue, we can draw glossopharyngeal nerve, and it also has inferior ganglion like vagus and nucleus solitarius. That is, it is possible 9th cranial nerve the same. And only organs of the head, only organs of the head, supplies through trigeminal nerve, through trigeminal. All another organs, we explain innervation of inner organs both through sympathetic nerves, for example, larynx. One way through vagus nerve, you already said.
Yes.
Another way from larynx, rami larynga pharyngeal, then superior cervical ganglion, rami interganglionaris, superior thoracic, ramus communicans albus, and first sensory neuron in spinal ganglion. That is why larynx has innervation through sympathetic trunk and thoracic nerves, one way, another through vagus nerve. Yeah. And organs of the head only you will explain through trigeminal nerve. For example, eye, sensory innervation of eye, nervus ciliaris and longus, and brevis, both. Then nervus nasa ciliaris. Then nervus ophthalmicus, and first sensory neuron, ganglion trigeminal. And from this ganglion, radix sensoria goes to nucleus spinalis, or nucleus principalis and mesencephalicus. Or if we speak about lacrimal gland, nervus lacrimalis, nervus
ophthalmicus,
ganglion
trigeminalis,
sensory root,
sensorialis.
and this nucleus.
Okay.
Or innervation of parotid gland. Nervus auricular-temporalis, nervus mandibularis, trigeminal ganglion, sensory root, and sensory nuclei. Sublingual and submandibular glands through nervus lingualis, nervus mandibularis, ganglion
Trigeminalis, sensory root, and then 3.
nasal cavity or
Palatine.
nervi palatini or rami
Radix
nasalis posteriores, then
Pterygopalis.
ramus ganglionaris, nervus maxillaris, ganglion
Ganglion
trigeminalis.
trigeminalis.
That is why in my diagram here we add trigeminal nerve, that is ophthalmic, nervus maxillaris,
And
nervus
mandibularis,
mandibularis, trigeminal ganglion,
ganglion,
and then trigeminal nerve goes to nucleus pontinus
Pontinus.
or nucleus spinalis,
Spinalis or mesencephalicus.
mesencephalicus. And from this nuclei we have lemniscus trigeminalis, trigeminal lemniscus. In your textbook it will lemniscus medialis,
Medialis.
because it also goes to lateral nuclei of thalamus and then goes to brain cortex. And this is fifth cranial nerve. This diagram is present in your textbook. Have you got textbook? Sympathetic and parasympathetic reflex
arc.
and these two diagrams, and interoceptive analyzer from inner organs. Here it is spinal ganglion, this is sensory ganglion of vagus and glossopharyngeal nerve, and this is trigeminal ganglion. Oh, here this is number 10, that is nucleus spinalis, but it's possible to write everything: spinalis, pontinus, and mesencephalicus, and then lemniscus trigeminalis or lemniscus medialis, like in your textbook, and then thalamus and brain cortex.
Okay.
This diagram and two reflex arch, 3 diagrams will in mini exam.
Okay.
And next time you will answer everything, all innervation of all inner organs: sympathetic innervation, parasympathetic, and sensory or afferent innervation of inner organs. We finish at 1:45, I think.
Yes.
That is why we have 45 minutes. We take some minutes for break, and then I come here and we try to discuss sensory innervation of different organs. Okay? Well,